Okay. All right. So, following up from our intro to women's health, today we're going to talk about why acupuncture or how acupuncture and herbs too is patient centered, right? So, part of my core philosophy when treating anybody exclusive of acupuncture, herbs, or just counseling patients, the first aspect of my care is patient centered. Okay. And that's combined with evidence, because as I've said before, everything I do is evidence based. So I like to use studies that are out there, not so much RCT type studies, randomly controlled, because it's very easy to manipulate the data and the statistics. But I do like basic scientific studies. So I want to see in the grand scheme of things, or in the grand scope of science, how acupuncture works, right? Using a Western science and biological and physiological paradigm, how does acupuncture work? The third part is just experience, right? Doing it over and over again, over 20 years, and having the knowledge, not the confidence per se, but the knowledge through the experience, which leads to confidence, to say that, yeah, this stuff works. And I can say that safely at this point, that this stuff works. So getting back to the first part, and of course, when you put it into like a Venn diagram, right in the middle there, the 3 parts meaning is you, the patient, okay? I hold a doctorate in acupuncture. What that means is that you don't need a doctorate to practice, but what it means is that I care enough about the medicine that I went the extra mile and took the extra courses to achieve the doctorate. The doctorate, I was able to explore genomics for early detection and prevention of disease for public health, and then further explored an epigenetic model for acupuncture. How does acupuncture work on the genomic level? That was the hello, Jacqueline. Thanks for joining us. So we want to see how we can harness the genome to better serve the patient through what we do. Because at the end of the day, when we're talking about fertility and health, we're talking about cells. And the egg cell is a cell that your body produces, and it's produced through the ovary. And, we can genomically harness that power and create better eggs. So that's where the genomics plays in. But I didn't grow up and wake up one day to decide to be an acupuncturist. It was sort of a long journey. Back in the 90s, my family was involved in ship repair, so I have a heavy industrial background. And within the family, as the only son of a Greek in a Greek family, you're supposed to take over the family business, which is great. But I have an undergrad in business science, production operations management, and I no longer want to study more business. And education was really big in my family, so my cousins were on me all the time. Like, now you're out, you have to go for your professional master's level education. So there was a lot of pressure, and I didn't want to study business anymore. So at the time, I had been doing some martial arts, reading some Eastern philosophy, as most people do in their 20s. Started reading about this, esoteric force called Qi, and I wanted to explore it further. I had an interest in bio and science and medicine, and my hope was to really understand more what this, esoteric force called Qi was through a Western lens, and quantify it through science. And of course, after you study business, the next logical step is to study acupuncture. So I enrolled in a program, and I graduated with a degree, a master's in traditional Oriental medicine, and that's how I started acupuncture. But how I started doing women's health was, once I met my wife. My wife is also an acupuncturist. We went to school together. She won the coveted Camel Herbal Award. She's a fantastic practitioner. So what happened is, I met my wife. We got married. We decided to start a family. And I would see some fertility patients, some women's health here and there, but until I kind of met, our OBGYN, my wife's OBGYN, he kind of, took me under his wing. He's the kind of guy you would want as a doctor, right? Gray hair, all this experience, But he was like an advocate for acupuncture. And he said, you know, I studied it when I was younger, and I realized it was over my head, and I stuck to, you know, obstetrics and gynecology, and I decided to let other people do the acupuncture. And we started talking about, you know, health and wellness and fertility, and he started, you know, referring. So he really helped me kind of propel and launch. And I admire him as a clinician, like kind of hands on. I remember at one point, on our third child, my wife had lost her father, and you know, there was some stuff going on with wills and stuff, and he was very matter of fact. He said, "Listen, you know, you're having a baby right now. You can't be bothered with this stuff. So your priority is this, and let them wait for you." And I thought that was really nice to go the extra mile. And I kind of do model myself after. I try to model myself after and be a little more compassionate on people having difficulties. But being in Staten Island at the time, the coverage, the insurance coverage, wasn't there for women's health and fertility and IVF. I mean, it was there for women's health, but not for IVF. So I would see a lot of patients who didn't want to spend like, you know, $10,000, $20,000, $15,000, and would try acupuncture first. And we were able to do some good work. So one of the things that I don't care for in the field is the label of infertility. All right. So I don't really like infertility as a term. It has a negative connotation, and it impairs people's feelings and thoughts about the process. And that's a big part of it. As you'll see, there's a mental component to it that we don't want to you know, stigmatize people. So the term is fertility, not infertility, because, you know, once you start this, you know, everybody starts to hammer you about, you're too old, your eggs are bad, you're running out of time, and then you get family pressure, right? You get, when are you going to get pregnant? Then your friends ask you, are you pregnant yet? So it's a lot of pressure. And then finally, you know, you'll hear women firsthand say that, you know, I went to a baby shower, and, you know, that one was pregnant, or that person got pregnant. And patients tend to internalize that, and it causes stress. And then the nail in the coffin really in the whole thing is the lack of intimacy, right? The process is, you know, we're going to do this all in the lab, you don't have to worry. And that kind of kills the emotion. And when it doesn't work, it tends to snowball into like, you know, an emotional burnout. So whether you see us as an acupuncturist or Chinese medicine, or if you decide to go the infertility route, or if you decide not to do anything, it's intimacy that's really going to be the driving force. That's really what's going to determine. So even if you're doing IVF or you're doing acupuncture, the body needs to get cues physically that it's time to get pregnant, and that's where the intimacy comes in. And I do recommend that for all my patients, no matter what you decide to do. You have to do IUI, IVF, acupuncture, nothing, walk away from it all. You have to be, intimate. So why is it patient-centered? It's patient-centered because I try to walk all my patients through what's going on, okay? And what's going on is that our bodies have not changed very much since our early ancestors, the early Homo sapiens, right? So if you're getting chased by a saber-toothed tiger, if your husband was trampled by a mastodon and the invading tribe is taking over your cave, well, guess what? Your body is not going to get these cues. Actually, it goes into a state of fight or flight, which we call sympathetic, and that stress kind of shuts down all the autonomic processes of the body, and it basically signals to the body, don't get pregnant right now. That's just how it is. But if you were to kind of extrapolate to today and we walk those back, like you're too old, your eggs are bad, you're running out of time, are you pregnant yet? When are you getting pregnant? All that stuff, it's no different, and it kind of adds up. So we have these are called emotional stressors, and these emotional stressors really, I think that's probably the worst of it. It's like people, patients who go through this, walk through these thoughts over and over and over again, and it's like you can only beat yourself up over your condition so much. You need to take the time out to kind of shut your brain off and give it some room and some time to heal, because frankly, the brain is really just a ball of uninsulated wires. And what happens is like you literally burn out. Those thoughts, right, burn you out. And right at the base of the brain is the pituitary gland, right, which commands all the hormones, right? And you can't have a period if the signal doesn't get here to here without passing through the pituitary gland. So when you're constantly under pressure, you're nervous, you're stressed out, it kind of throws off that mechanism. So we call that the hypothalamic pituitary ovarian axis, and it's very important. It's critical, right? Now, on top of that, we have chemical stressors, right? Think about this, right? You're given a bunch of medication. You're going for your IVF. You want to get pregnant. You're on the pill, which basically tells you you're pregnant. You get you pumped up full of progesterone, which tells you you're pregnant. Now you want to get pregnant, but the body's getting signals that it is pregnant already. Now you go to implant the embryo. What do you think is going to happen? Those chemicals are really, really harsh on the body. And I'm not the one to make this up. This is what I'm getting firsthand feedback from the patients. And then the final stressor, which happens not very often, but is common enough to make a note of, is physical stressors. Like when you're trying to get pregnant, it's not the time to do CrossFit. It's not the time to run. It's not the time to lift weights. Unfortunately, physical exercise kind of promotes testosterone, and that further throws off your hypothalamic pituitary ovarian axis. It's called exercise-induced amenorrhea. And then there's times where patients just don't have a period from that, and we need to kind of bring it on. So that is the physical, emotional, chemical stressors that throw off this sort of how the brain communicates with the reproductive organs. So what happens when you're stressed out, you release cortisol. When cortisol triggers noradrenaline epinephrine, it's like you're stressed out all the time. It's that adrenaline boost that you use to fight off saber-toothed tigers, not to get pregnant. That needs to be off in order to get pregnant because it's a preserving mechanism. So, the good thing is that acupuncture, we know, releases endorphins, and it helps cut that signal out, and that's how it usually works. So we normalize that access there. So when we get down to it, and the other thing that differentiates acupuncture from all the other stuff is that we have a very sort of deep intake. It's called the 10 questions. And we start from head to toe, and we try to form a profile. And this is a lot of times what I see. You'll get a diagnosis of low ovarian reserve, unexplained infertility, and this is what it looks like. It's basically hot flashes, night sweats, anxiety without trauma. I want to be very clear here that anxiety without trauma. We will always ask, we'll always, kind of indicate, if there's anxiety with trauma. It's very different than just anxiety by itself, because a lot of times progesterone kind of causes people to get anxiety. Insomnia, irregular cycles, painful periods, dark blood with clots, migraines, and stress. Okay, these are very common symptoms that we form into a pattern, which are all treated with acupuncture, right? We get into the nitty gritty of it. I want to see a 28-day cycle. I want there to be no pain. I don't want there to be clots. Unfortunately, sometimes there's accessory symptoms like low back and knee pain, digestive issues, breakouts, things like that. I want to know everything about that, because that's what's going to dictate how I'm going to choose my treatment strategy, right? Am I going to regulate the cycle every 28 days? Am I going to try to balance out the hormones because the hot flashes and the night sweats? But these are all indicators that something's going on, and it's like a marker, and we can use them to help the patient achieve their goals. So that is the intake, which is pretty comprehensive. And then once we establish a profile and a protocol and we treat for a while, there are other indicating factors that I try to recommend to my patients, because oftentimes patients are going for IVF. Okay, and they're dependent. Their brain is on day 11 post-transfer, which is the blood test that determines whether you're pregnant or not. And it's not a good place to be, because you just never know what the results are, and you're really kind of chasing. If it doesn't happen, there is this level of despondence, and when it does, you've caused this extra sort of like stress on yourself that didn't really need to be. So it's better not to be there. And of course, I know it's easy for me to say that to patients, but I do recommend that they take on and be distracted. That's the good time to do the yoga, to do the hobbies, to do the gardening. People move in the middle of an IVF protocol. But what happens, oftentimes, there are some indicating factors that kind of paint a better picture. And that under ultrasound, we see the patient ovulating. We see the follicles in real time. So we see the ovulation. We know it's there. We have gotten the patient to a 28-day cycle with no cramps, or their periods are the best they've ever had in their life. Some people have endometriosis that needs to be addressed too. But for the most part, when we start treating, the patient feedback is that their period's regulated and they're doing pretty good. Uterine lining. We know that the uterine lining's there. They're being marked. Or if it's low, we increase it. If it's thin, we thicken it, stuff like that. And then the blood test will show that the hormones have been regulated. And those, I ask the patients to kind of go over that as like as a mile marker to say, you know what, I have a period, I'm ovulating, I have a thick uterine lining, and my hormones are balanced. There's no reason why I can't get pregnant in between cycles. And in the meantime, I recommend that they are intimate, because whether you're going to do IVF, IUI, or the natural way, the body has to receive those cues. It has to be in a state where it is going to get pregnant. And if you're not intimate, then that's oftentimes where I find the IVS is unsuccessful. So, intimacy, seeing the follicles, having a regular cycle, the uterine lining, and internalizing the information and allowing yourself mentally to become pregnant. So that's a big factor. That's actually a phenomenon if you've ever heard, like, oh, she adopted a baby and got pregnant, okay? Or they got a dog, or they went on vacation, they got pregnant. That's the stress. That's the space. We're no longer beating ourselves up over our condition, and we've given our mind and body some space to get pregnant. So that's where it happens. And more often than not, when we're trying to bring the period on, guess when it comes back? On vacation while you're wearing a white dress when you're least expecting it, right? When you've taken off that pressure, when you've taken off and you're having, allowed yourself and given yourself permission to enjoy life and actually, celebrate your union with your partner, that's when everything falls in line. Don't wait for it to happen in the lab. There's no reason why people can't get pregnant on their own. It doesn't have to happen. But after you've been told that your eggs are no good, you're getting too old, and you're running out of time, that's a lot of pressure put on by the medical establishment. But I want to be very clear that if you're seeing me, not just any other acupuncturist, these are the factors that we want to see. We want to give you the room to get pregnant naturally. We want to give you the ability to give you the space to heal and achieve your goals. And that takes a little bit of work. And that's where the patient-centered aspect comes in. We will next time talk about, things we can do. So we'll talk about the tools. We'll talk about Western fertility. We'll talk about, acupuncture. We'll talk about herbs. And then we'll go into the data. But that's it for today. I did get some feedback from the outside world, outside of this office and the virtual space. Somebody asked me to bring up the fact that we do not leave the filaments in, okay? We take them out and we dispose of them as biohazard. We never reuse them, okay? So this is a good time to kind of bring up safety, right? We always swab to avoid contamination and infection. We take them out and we throw them away. We never reuse them. You should never reuse acupuncture needles. And no, we don't leave them in, and you don't take them home. Now, they do that in China, okay? But America's a very different world. I don't know if that we're prepared for that kind of stuff. You can, but rest assured, I don't. I don't leave the needles in. I always take them out, and they don't hurt, okay? So let's get over that. And that's, hello, Dr. Sarah, thanks for joining us. And that's really about it. I also want feedback. Again, remember, we're putting this together for a launch down the road. So whatever you heard here, what you like, what you don't like, give us some feedback, and also what you didn't hear. If you didn't hear anything in particular about fertility, please reach out and let me know. And if it's in my sort of like wheelhouse or my experience, I will address it. If I don't, I'll be straight forward and honest and say I just don't know anything about that, and I won't comment on it. So with that being said, thank you for listening. I think the next one will probably be Thursday night. We'll go deeper into more patient-centered type care, and then eventually we'll get into the evidence. So thank you for joining, and I look forward to talking at you again. Thank you.